Зараз у нас наступний доповідач, і також ми продовжуємо тему арт-терапії, буде якийсь про драматерапію. Майкл Рейсман, драматерапевт, цивільний прокурор у Генеральній прокуратурі штату Нью-Йорк, США, магістр мистецтв, доктор юриспруденції, викладання драматерапії в Україні під час війни.
Right. We would like to introduce next Michael. Yes, next we would like to introduce Michael REISMAN, who has Master of Arts, and he's also Dr. Juris. He's a freelance drama therapist and civil prosecutor in the New York State Attorney General's office. I had the pleasure of translating and providing language assistance to Michael during his drama therapy sessions here in Kiev. So that was a pleasure to meet him personally, and today he has a chance to share with us his experience of teaching drama therapy in Ukraine during wartime. Michael, the floor is yours. Thank you for joining us. Welcome, please. Michael, we can see the screen, but we can't hear you.
Maybe microphone?
Maybe is there an issue with mic? Please check. Oh,
Yeah.
There we go.
yeah, now we can hear you.
Okay, I did everything except that.
All right. Yeah.
Can you see the slide now?
Yes, we can see it. Yes, you can share the full screen so that we can see it. Yeah, it's half screen right now. Yeah, but we can see it. Yes.
Okay, excellent. So, thank you again, Pavlo. This is going to be like the Oscars, so I'm going to thank people at the start. There's Pavlo, Yulia, Zoya Romanets in Lviv, who organized my workshops there, and she's on the screen now. Taisia Tkachuk, who organized the Kyiv and Irpin workshops. So, as Pavlo said, I worked as a drama therapist for 10 years in the US and in Czechia, where I lived for 4 years. Then I became a healthcare lawyer. So I've worked for the last 12 years in New York State government, focused on improving access to mental health treatment. I continue to be involved in drama therapy, teaching workshops, publishing articles. I also remain involved in theater as a playwright, sometime actor, and so on. I went to Ukraine first in 2022 and 2023 to help Ukraine and Ukrainians. I volunteered preparing meals with World Central Kitchen and then Lviv Volunteer Kitchen. Some of my ancestors came from Lviv. I wanted to come back this year. So I thought, hey, drama therapy is another way to help. So I returned in April. I thought I'll get to teach one drama therapy workshop, maybe just one, in addition to chopping beats. And you see in these photos here, the one on the left is me. That's 20 plus years ago when I was a drama therapist. I wasn't a bum. Don't worry. I was in costume for a performance with some patients. That was in the Czech Republic, actually. The middle photo is me as a lawyer. And the photo on the right is me chopping beats in actually last November in Lviv. So, what is drama therapy? Drama therapy is the use of dramatic processes to increase a person's access to and tolerance of internal states that may have been suppressed or labeled as unacceptable or seen as threatening. And that's a quote that comes from my mentor, Dr. David Johnson, who came up with the method that I'll describe today, and which Pavlo and maybe some others on this in this session experienced last month. The goals of drama therapy, they're probably very similar to art therapy in some aspects. I think it's a very nice juxtaposition to talk about art therapy and then drama therapy. They're very much related. Some of my best friends are art therapists. I've worked closely with art therapists over the years. Mastering emotions, developing and observing self, expanding role repertoire, improving self-image, interpersonal skills, and empowering groups and individuals. And I should say, you know, in the parentheticals, the same concepts. I mean, the concepts on the left are kind of psychodynamic concepts and drama therapy concepts. And, you know, everyone today is translating their work into things that can be measured and outcomes. And so we talk about emotional change, self-regulation, increased flexibility, self-acceptance, relational change, cognitive change, and social change. Some of those, but not all of them, can be measured. And of course, we're in a world in which we're all trying to measure effectiveness. So this method of drama therapy that I have done for 30 years, and it was devised by my mentor, David Reed Johnson. It's an improvisation-based practice with groups and individuals. David developed this more than 40 years ago at Yale University, where he taught, and he also worked for many years with veterans, in particular Vietnam combat veterans, at one of the Veterans Administration hospitals in the United States. This method today is practiced around the world. There is a growing body of clinical literature, and it's used with groups and individuals in various settings, hospitals, clinics, with people with addictions, elderly people in nursing homes, schools, and of course in private practice. The psychological bases of this method are diverse. It starts with, of course, psychoanalysis, the concepts of free association from Freud and active imagination from Jung. There is a debt we pay to psychodynamic psychotherapy, in particular the object relations school. Really, to me, that's about understanding and improving relationships with others. Winnicott spoke about the transitional space, which is between self and other, and we're really trying to bridge that gap in this method of drama therapy. We also are indebted to developmental psychology, which speaks about the life journey through stages, sensory motor from the earliest stages of development to the symbolic level, and then the reflective level. I mean, in general, humans need more direction early on and then less direction as the lifespan proceeds. And we try to mirror some of these developmental concepts, as you'll see in a moment. We also draw on existential philosophy and humanistic psychology in terms of trying to get to the true self, to go through, work through some of the layers that we put on ourselves, the roles and masks, I mean, metaphorically, that we develop, and the defenses that we develop that prevent us from accessing the true self. There is also much interest, of course, in neuroscience, in particular related to trauma, how it affects the brain and the body. We'll talk in a moment about exposure therapy for post-traumatic stress disorder. And there's a very famous book that Bessel van der Kolk, a Dutch psychiatrist, wrote. It's been recently translated into Ukrainian, I believe. And I think it's very fitting that in this book, in which he describes his 5 decades of experience, the last chapter is on theater. And he wrote that theater gives trauma survivors a chance to connect with one another by deeply experiencing their common humanity. So that's what we aspire to in drama therapy, in this developmental transformations, or DVT. I mean, that's maybe the end result. There's a lot of work to do along the way to get to that point. We also have, of course, theatrical roots, going back to ancient Greek theater, ritual and catharsis. There's Moreno, who invented psychodrama, came from Central Eastern Europe, actually ended up about 10 miles from where I'm sitting to the north in Beacon, New York. Playback theater is something that's also done around the world, including in Ukraine, I believe. We draw on experimental theater, much of which is nonverbal, or just a little bit not quite in the realistic realm. We draw on performance art, as well as theater that's been done in hospitals, prisons, and community centers. Quickly, the role of the developmental transformations therapist is to create a safe play space, to actively participate. And this is perhaps the most important aspect that distinguishes this method from other methods and perhaps from psychodrama, that the therapist is in role, leading, but you know, it's follow me. I'm going to jump into that play, as opposed to you guys go play and I'll watch you and direct you. The therapist is always monitoring and adjusting the flow, looking at the degree of structure, how people are expressing themselves, if it's just sounds, if it's images, if it's words, and how connected people are interpersonally, emotionally. Are they distanced? Are they really expressing strong emotions? The therapist is generating hypotheses about what's going on, what the themes are, what the issues are within the group, and of course, improvising and trying to transform to develop the group to get deeper. The stages of a session, we start with a greeting, we enter the play space. We always start, then proceed to a unison activity, a basic sound and movement, which is a kind of a technique that's widely used in all kinds of theater training. The therapist will define, ask questions about what people are doing. That will develop into personification, sometimes animals, quasi-humans or humans. Then we go into structured role play, then unstructured role play, and we see what develops. And there may be many scenes that develop. And then we finally get into a closing ritual. We de-roll and we have some discussion to end the session. So drama therapy in Ukraine, April 2024. Seems like a long time ago, but it was only a few weeks. In fact, I really, well, my wife is watching, so, but I wish I was there. I miss Ukraine. So in 12 days, I was in 3 cities, led 8 sessions with 200 participants altogether, psychologists, students, and artists. The questions I went to Ukraine with that I was always thinking about: can we play during wartime? Is it okay to escape into fantasy? How do we start? How do we end? So I was always thinking about those questions. And now we're going to get into a little bit of a demonstration. I will see, hopefully this will work. It's a video, but before I show the video, I'll just say that, of course, images of war and weapons came up in every session. So this first group in Lviv that I'll show a short video clip of, the members of the group wanted to get rid of an imaginary pile of weapons that they had conjured, and were, you know, it all developed again out of a unison sound and movement. You see that people are roughly in a circle. I'm on the right. Yeah, I think you can see Zoya there on the right as well, kind of standing in a crouch. So we were in this moment, in this short clip, deciding what to do with the pile of weapons that we had conjured, this imaginary pile of weapons.
Let's look at all the weapons in the middle.
Давайте зберемо цю зброю всередину, зробимо таку велику кучу, покидаємо всередину. Багато всередину це.
And make sure you check your legs and get rid of all the weapons in.
Перевірте, що свої ноги, чи у вас нема що кинути.
And shake them out of your arms.
Своїх рук так само свої.
Let's get rid of all the weapons.
Давайте витрясемо цю зброю, центр,
Get rid of them. And what can we do with the weapons?
А що ми робимо з зброєю? Що ми робимо з зброєю?
Ми захищаємося. Ми захищаємося.
Що ми знаємо робити?
Okay, so you know, I will say that this was a key point in that session, because there were people who did not want to get rid of the weapons. I mean, maybe half the group didn't, and half the group was sort of more into the peace concept, and that's kind of where the group went, into just imagining peace and peaceful images. So it's, and there's some feedback I got, which if we have time, there's a slide I'll show with some comments I got. But you know, it's important to recognize that, I mean, this was a large group. It was a teaching session. It was larger than probably a group that I would ever do with clients of any kind. There were maybe 20 people in the group, but the job of the therapist is to try to engage everyone, to make sure everyone is engaged. So in thinking back on this moment, I think what we decided to do was we kept the weapons in a safe place, but we weren't going to continue to play with the weapons, like to pick them up and start shooting at each other or shooting at enemies out there, which we could have done. I mean, and I've done that in trauma therapy sessions with psychiatric patients, where again, in a safe place, everyone knows it's make believe, but it's those violent images come up, and they have to be, sometimes they can be addressed. But in this situation, we chose to, or at least I, as the leader, chose to try to thread the needle, so to speak, between the part of the group that wanted to be in a more peaceful realm versus the part that was more focused on the weapons. But I will say, after this, I did an individual demonstration session. So I was thinking, okay, maybe I shouldn't dive too deeply into war themes, into specific war themes. But the volunteer was a very brave woman from Mariupol named Claudia. And we had a one-on-one session in which, of course, the gentleman who's back, you see in the clip there, he was my translator. So Claudia and I went on an imaginary journey. We flew over Mariupol. She described it to me and described her experiences and the fact that, of course, it's destroyed. Her home is destroyed. She wants to go back home, but she can't. It was very, very powerful. I mean, very real world. Obviously, these are events, and having seen recently the film 20 Days in Mariupol, I could very vividly imagine what she was describing. I mean, even if I hadn't seen the film, I could imagine it. But so there were no other words to say that I could think of to say, except to listen to her. We sat in silence for a while, and then we went back to Lviv in this journey in the play, and then we reflected on it. We de-rolled, and there was a very good discussion. This image of a magic carpet came up in another group in Lviv, in which the students traveled on a magic carpet to Crimea, thinking again about war images and the things you might find on a beach in Crimea today. But we had a beach party in Crimea. The students sang a poem by Shevchenko, which was very moving. And to conclude, we passed around a magic seashell that granted each person's wish. And the wishes were very, heartfelt, profound, for peace, victory, to be reunited with loved ones, and so on. So the next clip I'll show is from Irpin. So I did some workshops in Lviv, and after taking the overnight train to Kyiv, I spent the morning walking through Bucha, and then in the afternoon I went to Irpin, and in a building in which the next building was half destroyed still, I led this workshop, and this is just to give you a sense of the beginning of a session. I think that's what this clip shows. Sorry that this is sideways, it's the same clip. So I show that just to demonstrate how the sessions begin with this sound and movement, and it can go on for many minutes, but from these gestures arise words or sounds, and sometimes characters. What was interesting about this session was that we again had word themes, but the group members, especially the men, were more interested in traveling the world and arranging a festive wedding and dancing all night long, which is probably something they hadn't had the chance to do in quite a long time. This is a still photo image of me in the center there with my arms raised and stepping forward, and someone said to me, that looks like you're you all are doing the wave, but Michael, you couldn't wait and you just jumped right in. And that is kind of what happened, because as the leader of the group, I'm trying to, really get people into the movement. And you see the woman on the right, she's also jumping in, and people do the movements as they can with whatever abilities they have. So the final example I'll show is from Kyiv, and that's where you see Pavlo in the image there. So in this clip, we are going to the Emotion Museum, and this is with university students, and I think they were all only university students. So we had done emotional sculptures, which is an exercise, which is a warm-up, which could lead to lots of other things like scenes and so on. The students were in the sculptures in small groups, showing emotions like anxiety, disgust, sadness, anger, and joy.
And I'm going to point to a group and you'll unfreeze. You guys unfreeze. And quickly, I'm going to take you on a tour of this museum.
We're in the museum.
You can go to this room. Look at these statues.
They don't look happy.
They don't, no? Okay, and now to this room. And what you see here, while you
Що ви бачите тут? Disappoint.
Yeah, I think the last one was disappointment. I don't know if that was the disgust room or but it's a way of embodying these emotions, getting people activated. I will say that in this session, the air raid sirens were going off all day, and you get used to them. At one point in this session, after the clip you see, the students had created an image of air defense missiles, and we were deciding what to do with the air defense missiles when one of the teachers stepped in and said we had to stop because of the warning, which maybe was more dangerous, and the students had to go to the shelter. So I went to the office and I drank cappuccino for half an hour, and I was asked, are you scared? And I said, well, a little, but not really, because I grew up in New York City. And I think it was the dean of students said, she looked at me like I was a lunatic, which was, for saying I wasn't scared. I mean, I was somewhat scared, but it's part of life, obviously, now in all of Ukraine. I will say, after the warning ended, the students came back and we resumed the session, and we did an exercise called Magic Shop, in which each person has a chance to buy something from this magic shop. Like, it could be a concrete object, or mostly it's like emotions or emotional states, like confidence, but you have to give something up. So you get to buy something that's really important to you, but you have to give something up. And for me, it's always, if I play this game, it's the knowing that I'm always right is what I give up. The knowledge that I'm always right. I'm willing to give that up. And this is actually the conducting of the emotional orchestra. So I am holding in my hand there in the photo, and Pablo's behind me, it's the emotions that are written on the papers. The students actually came up with the emotions. That's essentially the music, and they are the orchestra, and they make sound. They convey through sound the emotions, and I hold up each of the emotions and point to people, and that creates the orchestra. And then each student gets a chance, if they want, to become the conductor. So just wrapping up here, there were some very interesting participant comments about how quickly the war images came up, and how quickly they faded. There was freedom in the group and playing with these feelings, which are sometimes traumatic. There was also the comment that some folks, some participants were more expressive and, you know, have more outgoing personalities, and others are hold back. And it's a challenge especially in a large group, to balance that. In particular, when we had an image, the weapons I mentioned, in which some people didn't want to give them up. They just wanted to stay with that image. And that the person commented that the group exercises were meaningful, and they enjoyed observing others. I'll just say very quickly here, you know, regarding trauma, there is growing literature about the use of this method of drama therapy, DVT, with PTSD, with combat veterans, with children. I think it's important to say with PTSD, everyone is at risk, but its incidence can be overstated. I think sometimes normal reactions to trauma should not be confused with PTSD. And that's it for now. Дякую за питання.
Thank you. Thank you. Michael, are there any questions to Michael?
No.
Так, Лариса,
Yeah,
так.
Just
Лариса.
a practical question. I'll speak in English because American. Thank you so much for your presentation, Michael. It's exciting to hear that you're working in Ukraine. And how can any of us get in touch with you if we want to speak with you in more detail in the future about what you're doing? And will you come back to Ukraine?
Yeah, I am. Well, second question first. Yeah, yes, I'm hoping to go back in the fall of this year. And my email address is in the slides. It's you can get it through the conference organizers as well.
We will be happy to connect you. Just let us know, let the organizers know, and we will connect you to any of the participants of the conference, because these discussions should take place and continue, I think.
Yeah.
And we don't have so much space or time to develop them right away. So yes, please do reach out, and we will share the context. We will introduce you, and that would be great if this discussion continues. Thank you, Larissa, for reaching out.
Thanks.
Thank you. And perhaps I might ask a question. Michael, there is some people say that emotions are universal. Other scholars say that they are culturally defined. When we observe emotions in Ukraine, have you noticed these, let's say, cultural aspects of the emotions that Ukrainian society speaks about, in contrast to the way that emotions are talked about in American society? Like, have you noticed any culturally specific emotional responses in Ukraine? Thank you.